Still technique, thoracic vertebrae, neutral, T5, side bent left, rotated right. Ask the patient to sit comfortably on the edge of the table. Stand or sit next to the patient. Adjust the table so that the patient's shoulders are at or just below your shoulder level. Contact of tissues. Monitoring hand. Use your index or middle finger to contact the posterior transverse process of the dysfunctional segment and surrounding soft tissues. Gently layer palpate to the level of the transverse process to monitor for bony segmental motion. Operating hand. To create a sufficient activating force, 2 compressive forces will be aimed at the dysfunctional segment. This is achieved by placing your arm anteriorly across the patient's shoulders and upper chest. One shoulder is controlled with the operator's axilla and the second with the operator's hand. This allows you to control both shoulders simultaneously. Visualization. Mentally review the motions needed before initiating them on your patient. Application of principles. Monitoring hand. Maintain contact throughout entire procedure and palpate surrounding tissues and position of dysfunctional segment. This hand is used to ensure that the activating force is localized to the level of the dysfunctional segment and will move with the dysfunctional segment. Operating hand/arm. Place the dysfunctional segment in the position of the somatic dysfunction in all 3 planes using your contact on the patient's shoulders as a lever. The monitoring hand should detect some decreased tension. In this example, T5 neutral, side bent left, rotated right. Add a downward compressive force through both shoulders aimed towards the dysfunctional segment until the force is localized at your monitoring hand. Tension in the surrounding paraspinal musculature should again decrease slightly. Visualization. View the activating force as a vector from your operating hand and arm directly to your monitoring hand. View the long lever as one functional unit that you will apply compression through. Fluidly move the patient's body to move the dysfunctional segment in all 3 planes of motion, simultaneously toward, then through the restrictive barrier. In this case, T5 neutral, side bent right, rotated left. Release the compressive force. Return the patient's body to neutral. Retest. Retest dysfunctional segment for improvement.